as the first female urologist in Nigeria. That's a great is a great achievement. All right, so in a short while, I'll be handing over. In a short while, but I want to use, so I think the admin. So while she's setting up, she can begin to share her screen. Okay. All right, she can begin to share her screen while I just receive her bio. It's good we know about this wonderful woman. All right, thank you so much. Dr. Bimbola Bolariwa had a basic education at the Air Force Primary School, Kaduna, and the Air Force Girls Military School, Jos, in Plateau State. She studied medicine and surgery at the University of Ibadan, and thereafter had a youth service at the Nigerian Military Army Reference Hospital, Kaduna. She had a residency training in surgery and urology at the Lagos State University Teaching Hospital, Ikeja. She had a fellowship in urology from West African College of Surgeons in 2013. This made her the first woman in Nigeria to attain this status in a previously only surgical specialty. She has special interest in andrology and pediatric urology, and desires strongly to further develop medical education in Nigeria. She is passionate about her patients' welfare and loves to teach. She obtained a distinction in a postgraduate diploma in education from the University of Lagos in 2018 in pursuit of her desire to be an excellent teacher with plans for a doctorate soon. She has received several awards and widespread recognition. And currently, she's a senior lecturer in the Department of Surgery, College of Medicine of the Lagos State University, and an honorary consultant urologist with his corresponding teaching hospital, Lagos State University Teaching Hospital, Ikeja. So, welcome on board our elder first speaker, Dr. Abimbola Bolaniwa. You are very much welcome,
Thank you very much, sir.
All right, ma'am.
Thank you very much. Good evening, ladies and gentlemen, my fellow colleagues. I'm happy to be here this evening. Thank you, Dr. Emati, for successfully bullying me to come and speak today. And also, thank you for the introduction. Actually, I know the hype about reading my profile is always first female urologist in a previously male-dominated specialty. And I find that very strange because men have been everywhere. Now we are just bringing ourselves and everybody is shouting about it. We are here to stay. We're not going anywhere. We are about 8 in the country now, and 3 more are going to join us by the end of this year. So you shall have many more profiles to read because more women are coming in. So we'll be discussing lifestyle medicine, the approach to male fertility, but I'm going to give the urologic perspective. And of course, those are my affiliations, Lagos State University and the Teaching Hospital. Okay, so by way of definition of infertility generally, I hope you can hear me. I hope everyone can hear me. Am I audible?
Yes, you are. Yes, you are. We can hear you.
Okay, thank you very much. So when we are talking about infertility, we're just referring to the inability to conceive after 1 year. Now, I made these words bold because we have ridiculous patients. But let me just say it, regular penetrative, and unprotected sexual intercourse. For those that are, for women, particularly that are above 30 years old, we say 6 months. We don't wait for 1 year any longer because there are so many options of assisted reproductive techniques now. You don't even have to wait for 1 year. So once you're above 30, you just start, 6 months is what we take. Now, why did I make these words bold? We have some patients that will come and say, oh, I've not been able to achieve pregnancy. Village people are following me. Okay, Oga, where do you live? I live in Kaduna. Madam, you are in Lagos. Of course, intercourse is not regular. Regular means 3 times, at least 3 times a week. Penetrative. Some people have all sorts of sexual fetishes. They don't believe in penetrative intercourse. They get their orgasm and their satisfaction. Some of them are as weird as peeping through the window to watch their wife undress. And so how are you supposed to achieve pregnancy? And then we've had cases where some people come and say they're using condom because a lady told me, I remember she came with the husband to and told me that she does not trust the man, so she insists on condom. Madam, how do you want to get to Bele? So you see, we see all sorts of ridiculous people that come. So you must establish that this patient has regular, more than 3 times, at least 3 times a week, penetrative into the vagina, please, not the opposite, not anal penetrative or any other orifice. It has to be vaginal because that is where the uterus and the vagina and the cervix are. And then unprotected. You can't be wearing condom. You can't be using spermicides and be telling me that you're not getting pregnant. So let's clear this. Let's have this because when you are clerking patients, you are doctors. We are doctors. We tend to forget that we are talking to people that are non-medics. So when they tell you these things, we just take it that, oh, they know what they are saying. Until you probe and ask them these things in detail and you realize that they don't even fit the criteria of those that have been unable to achieve pregnancy because they are not even staying together or they are fighting every time, ovulation comes, or they are not, so many things. So these are the chances of a normal couple conceiving. By 12 months, by a year, majority of normal couples, normal male, normal female, without fertility issues should achieve pregnancy. Now, male factor alone is 40%, female factor is 40%, and combined factors 20. So male alone carry 50%. So when people keep on, blaming women that, oh, you're not getting pregnant, it's a 50-50 thing. Everybody, everybody has the equal chance of being the cause of the infertility. And we assess a couple, we don't assess the man alone. But because you need to identify the problem, we now have to separate female and male. So the male come to the urologist. So definitions, primary infertility is when a man has never impregnated a woman before, ever in his life. So a man is coming to you and you're asking the question, have you ever achieved pregnancy? Let's forget about your wife. Before you married, any girlfriend claims she has pregnancy. Now, I noticed that majority of the men, I'm giving you stories now. Majority of the men will say, there's the 1 or 2 girlfriends in the past that they claim pregnancy. How long was the pregnancy? 1 month. What happened? She terminated it. They have run the man straight. You see, a lot of times, by the time I examine and assess the patient, I actually say that they have they have primary testicular failure. They've probably never been able to achieve a pregnancy from birth. But they will claim that so many girls claim that they were pregnant because most men equate erection with fertility. Oh, I'm able to achieve an erection and ejaculate, but they are shooting blanks. So primary infertility is that he's never achieved it. Forget the stories they are saying. They will always claim somebody somewhere. But, as long as that pregnancy did not have an outcome that a child was delivered, and even if a child was delivered, we don't like to go into the gray area to know, is this child really the man's own or he was giving somebody else's own? But anyway, you understand what I'm saying. Secondary fertility is a man that has achieved pregnancy, whether the outcome was positive or not, and he is not able to achieve another pregnancy when he desires to do so. So we have some married men. They had maybe 2 children at the beginning of the marriage. They took a break. They want to come back and have another child. Finances are better. Unfortunately, they're not able to achieve pregnancy. So that's secondary infertility. Or maybe a married man, or maybe a man that has changed his partner. He had previous children he wants to have now. He's not able to achieve pregnancy. Please note it, male fertility is quite unstable. The fact that you've achieved pregnancy before does not mean that it's easy for you because you still have an erection and you're able to have sexual intercourse successfully. No. So fertility is very unstable in a male. So you can't just assume, oh, I can't be the one at fault. No. We will assess you per time. You're looking for a child now, we assess you. Forget about your past history. Your past history only tells us that you were fertile before, meaning that whatever has happened was between that time and now. Subfertility, there's a probability of spontaneous conception, but is decreased. And then sterility is when they are unable to achieve fertility or achieving a pregnancy and it's permanent. So what are the factors that are good for male fertility outcomes? Good hormonal balance. Genetics also favor some people. Some people have very poor fertility in their families. I mean, sometimes take a history, you see a man that in their family, 4 of the men are not able to achieve pregnancy, and the only one that's gotten a child only has 1. So some of these things are important. Production of healthy male gametes. So the testicles must be in good health. The testes, left and right, the testicles is the source of sperm cells in the male. And that factory must be working well. The testicles has 2 major functions: production of gametes and production of hormones. Testosterone is the major one. Of course, it produces inhibin too, and relaxin. But you see, those 2 functions must be working perfectly for sperm cells to be produced. The medium of delivery, that's the seminal fluid. The sperm cells, so the reason why the sperm cells need a medium of delivery so that the sperm cells are kept alive for the long journey into the female reproductive tract. Delivery, there must be delivery into the female tract. There must be good erection, there must be penetration, there must be ejaculation. So these are all the steps that will ensure that the outcome is good. And of course, the female factors. So this is what I just said. Production, the raw materials must be available, all the micronutrients that the testes needs to produce sperm cells. The factory itself, the testicular cells, the Sertoli cells, all the branches and the scaffolding in the testes where the Sertoli cells produce sperm cells must be intact. Manufacturing and quality control, very important. Testosterone must be available, not synthetic testosterone, not gel, not patch, not injection. The local one, the local testosterone produced in the testes is what supports sperm cell production. And then storage in the epididymis. After it's produced, it is stored. It's not every time a man has intercourse. So it is stored. It is only when he's having intercourse that the sperm cells that have been stored will come out. So there's always a reserve. So that is important. Packaging, the epididymis, that's a storage. Transportation and medium of delivery. Seminal fluid must be intact and healthy. And then, of course, mode of delivery, the penis. The man must have good erection. So you see, so many factors are important in ensuring fertility. Now, some men have erectile dysfunction. They're not able to achieve good penetration and all. And then you notice that those type of men, if you do an IVF, you extract it directly from the testes, they're able to achieve pregnancy. So their problem is mode of delivery. And these are other abnormalities of seminal fluid parameters that you see, when we see seminal fluid analysis tests. Normal zoospermia, normal ejaculates, normal, normal structure, normal counts, good motility. So when it's oligo, less than reference value for the sperm counts, when we say astenozoospermia, it means that the sperm cells are not swimming. Motility is poor. And that alone is the singular most important factor in seminal fluid analysis. Sperm cells must be active and move. Teratozoospermia is when there are abnormalities in form, 2 heads. A sperm cell should have 1 head, a neck, and a tail. This one has 2 heads, 1 head. Little monsters. And it's because the sperm, there's mass production. So some of them are not produced properly. Some of them are not produced as adequate as they should. It's just like mass production in China. They were defective in the goods that are coming by shipment. So it happens with sperm cells too. And then oligoastenoteratozoospermia, that is old syndrome, is when there's abnormality in count, abnormality in motility, abnormality in morphology. Cryptozoospermia, no sperm in the fresh sample, but they are recovered after you centrifuge. Azoospermia is mental, and aspermia is that the person is not even ejaculating at all. He's not even bringing up, not to talk of seminal fluid with sperm cells. So what are the causes of male infertility? Sorry, I'm trying to rush. Can you still hear?
Yes, we
Clearly,
can.
ma. Clearly.
Divide them on pre-testicular, testicular, and post-testicular causes. Pre-testicular causes are things that have to do with mostly hormonal. We talk about the
Is it just me or did we lose audio?
Yeah, I can't hear anymore either.
I think it's from our end.
Yes, I think she was kicked out. Let's just give a few minutes for her to come back in.
Right. Good evening, everyone. We are still waiting for Dr. Aboloriwa to join us back. And I'm looking at the chat and laughing because I see somebody calling her a plumber. She said the plumber is here. And then some people are hailing her super trainer. And there's a lot of laughter and wow. And really, we can't wait for her to be back because I'm already like super hyped. And all the positivity that she's bringing in. Maybe we should send her a message to just log out and come back in.
Okay, Dr. Ochen, are you sure you won't start your own?
Why will I wait? Why will I wait? Let me just use this medium to introduce the second speaker, and back. Maybe Dr. Ochena will have to start while we prompt her to return. Thank you. Yeah,
Are you
the
going to
second
read her
speaker.
bio?
Yes. The second speaker we have for tonight, who is supposed to take over from Dr. Abimbola before she was kicked out, is our own Dr. Uchenna Anekoye. She is a medical doctor and the founder and CEO of Health Rights Company Limited, a premier one-stop lifestyle medicine clinic and wellness center at Lekki, Lagos State. She is an international board-certified lifestyle medicine physician with a Master of Public Health degree and over 28 years experience from institutions, including Nigerian Army Reference Hospital, Lagos State University Teaching Hospital, and Toronto General Hospital. She holds additional certificates from the University of Toronto and John Hopkins Bloomberg School of Public Health. She started a lifestyle medicine journey by obtaining lifestyle medicine tools for promoting LD change from Harvard Medical School. A plant-based nutrition certification from the T. Collins Campbell Center for Nutrition Study, ECONEL, enhances our ability to help clients manage and reverse chronic diseases through evidence-based lifestyle intervention. She hosts Lifestyle Medicine with Dr. Uche on R2 107.1 FM radio station, where she inspires audience through preventive health and wellness education. She is passionate about lifestyle medicine and set up the Health Right Multi-Specialist Clinic and Wellness Center not just for medical treatment, but to offer preventive and health maintenance services as the foremost one-stop lifestyle medicine clinic and wellness center in Nigeria. That includes a gym, a spa, a nutrition hub, a physiotherapy clinic, a coaching and training center, as well as a teaching and demonstrating kitchen under one roof. It is a total package. So I present to us Dr. Uchenna Anikoye, who is going to take the lifestyle perspective to optimizing male infertility. Thank you very much. Is Dr. Abimbola, is she back? Let me see. Just hold on. Okay, she's not yet on the call. So let me hand over to Dr. Uchenna to start our presentation. When we're able to get back Dr. Abimbola, she will complete her presentation. Thank you for staying tuned.
All right. I was able to finish her own part so that we don't have to repeat a lot of things. Let me share. What am I sharing? What am I sharing? This one. So our topic is optimizing male fertility, lifestyle medicine approach. And Dr. Abimbola was supposed to give us all the plumbing works. I was really happy listening to her. And I didn't capture as much of what she would have dealt with, but I glossed over them. I will just gloss over them. I'm going to be dealing with the lifestyle approach. So anytime that you encounter male infertility, you know that it's not just fertility that we are talking about. We are also talking about that man's health. So over the prevalence globally globally and in Africa, she's been telling us. And then the importance of lifestyle factors is what I'm going to base my talk on, and the core lifestyle pillars. Of course, our pillars of lifestyle medicine, we bring in all of them here. Of course, when we talk about it, we talk so much about social connectedness, but social connectedness is part of what we need in interventions, but we minimize that and we focus on the other 5 pillars. It's usually both male and female that, kind of like they come together, combine the fertility, both the man and the woman. If any woman is not having a baby, it's not just the woman that has a problem. It could also be the man. So sometimes in 20% to 30% of the cases, it is just the man that has infertility. But in 50 to 60% of cases, it could be combined, influences. And you know that globally, we are seeing that there's declining sperm quality all over the world. It's not just here in Africa. And erectile dysfunction is also increasing throughout. But when we're talking about fertility, because of all the assisted reproductive techniques, we don't even focus on the erectile dysfunction part so much as before. But because now, if a man is able to, be able to discharge some of that serum, it can actually be collected and you can do IUI and do intrauterine insemination. That's what IUI is. Okay, so the marker for overall health is that about that erectile dysfunction. Just know that is a warning that something is, going to be happening to all his other vessels, because the penile vessel is very small. So by the time that one is having challenges, you know that the next one to follow are the larger ones, the coronary vessels. So anytime that a man is struggling with erectile dysfunction, don't just treat just that erectile dysfunction. But that's not the topic for today. But one thing I just needed to mention is that male fertility matters a lot, because it is actually a marker of overall health. All right, she already talked about a little bit about this, the hormones that act on the male reproductive system. And but I don't know if she mentioned that spermatogenesis takes approximately 74 days. That she has mentioned the sperm count, the motility, just the count. Now, lifestyle. Challenges with fertility. We always say start with lifestyle. Let the lifestyle be one of the first things before you go on to the other things. I'm not saying that it's only lifestyle. It depends on the case. But I'm saying that is the first point where you should start, because the way the world is going right now, the way we are living right now, will be affecting a lot of things. Okay, so I think I can't remember if she started on the pathophysiology, but let's just talk about oxidative stress. It damages DNA, and then that sperm is going to not be able to do anything, right? Heat and inflammation will impair function. The hormone disruption that we talked about reduces testosterone. And there's something that men always go and do. When they say they have low testosterone, they run and go and take testosterone. And the thing is that the body has a way of, when it senses you taking some external one, it cools down, it doesn't even bother. Now, I think Dr. Abimbola is back. Can we give her a chance to, give us the rest of our lecture, and then we can now get back to this. Hello, madam.
I am back. I didn't even know I was talking to myself.
Oh my gosh, you're welcome back.
Please, where did I stop? Tell me so that I can quickly join in.
Oh my gosh.
Where did I stop, please?
I think you were still talking about the types of mutations that can happen in the sperm. You had just finished talking about oats and all those other things.
Oh, since that time. Okay, let me rush. Can I reshare now? You have to stop sharing. You have to stop sharing first. I can't share my slides. Okay. Okay, so I think I was in so have I talked about causes of male infertility? Pre-testicular, testicular, and post-testicular. Can you hear me?
Yes, we're talking about you were on the slide on pre-testicular. That was the slide that was being displayed. This particular one, that has pituitary disease and all. That was the one on display.
And I talked about the hypothalamic pituitary gonadal axis.
No, you haven't talked about it. You just started talking about it.
Okay, so let me just quickly go through it. The hypothalamic pituitary gonadal axis is the control of the brain, generally, of the testes. The brain controls the whole body, either through nerves or through secondary messengers like hormones and all. So this is a hormonal control. The the brain produces gonadotropin-releasing hormones, which stimulates the anterior pituitary. The anterior pituitary has two major stimulus of the testes: luteinizing hormone that stimulates the testes to produce testosterone, and FSH, follicle-stimulating hormone, like the name, stimulates the testes to produce follicles, and that is sperm cells. So when the testis is working well, producing hormones, producing sperm cells, oh, very good. It doesn't, there's a negative feedback that tells the pituitary, stop sending LH and FSH. And then it tells the hypothalamus, stop disturbing me. Everything is okay. So there's a negative feedback. So most of the pretesticular causes are mostly these, these hormonal causes. And of course, by the time you now start having exogenous hormones, it can affect that negative feedback, giving the brain the impression that there's testosterone in the body. Meanwhile, the man is taking testosterone patches or gel or injections. Maybe he went to one place somewhere and he told them, I don't have libido, and they give him a testosterone injection. That injection is imported in testosterone. It's not local production. And local production is what is needed for fertility. The testis wants its own testosterone to produce sperm cells, not imported one. It doesn't recognize it. So that imported testosterone will suppress spermatogenesis in the testicle. And that's why we're very careful when we give supplemental testosterone. So the next thing is testicular causes, usually chromosomal abnormalities. We talked about Klinefelter syndrome here. Klinefelter syndrome, XXYXO. So you can see that they already have defective cells that will be used to produce sperm. So it can't happen. Testicular injury, undescended testes is what we call cryptorchidism. Once the testes are undescended, there's some damage, and then they are not able to produce sperm cells. Varicocele and others listed here. Systemic diseases like liver and kidney failure, and other toxins that are directly dangerous to the testes. Post-testicular causes most times have to do with obstruction. Obstruction, like congenital absence of the vas. We've seen patients like that. They don't have vas deferens. So they have good sperm cells in the testicles, but there is no pathway for it to come out, into the urethra. And then we have other things like acquired blockages, like vasectomy. I mean, you come and do a vasectomy and you're looking for a child. It's either you were not too aware of what you did, or you're just pretending, Groin or inguinal surgeries. Herniorrhaphy is one of the commonest causes, or hernotomy. So some children have had hernotomy for childhood hernias or hydrocele. Sometimes the damage has already been caused in childhood because there was mistakenly damage to the vas deferens. Then other things like ejaculatory duct obstruction, like maybe stones, urethral stones, scars, or cysts. Infections. Please let me stress this. This is the commonest cause of obstructive azoospermia in Nigeria now. I have gonorrhea. I go to one Abegi pharmacist and they give you herbal concussion. And it goes within 3 days, the purulent discharge will disappear. But the chronic inflammation continues. And it will cause obstruction to the vas deferens. It will cause obstruction to the ejaculatory duct. In some cases, it causes urethral stricture. So, and these consequences sometimes show like 10, 15 years after. So this is very, very, very important. And we must establish this history when taking a history. And then, of course, we have other things like functional causes like nerve issues that will cause a smooth muscle dysfunction, and then effect of some medication. So post-testicular causes also, we have these are other causes, disorders of coitus and disorders of sperm function and motility. But let's go to disorders of coitus. Erectile dysfunction. I mean, a man has everything in the testes, but he has erectile dysfunction, no penetration, nothing. They won't achieve normal pregnancy. And then, of course, the ignorance, timing, and frequency. The husband who lives in Kaduna and the wife in Lagos, in fact, everything is wrong about that. So now when we talk about components of the history, I circled this one in red to show you that this is very important in the history when you're taking the history. And we talk about urinary infections, sexually transmitted diseases and whatnot, viral otitis, whether these people had mumps as children, renal disease, diabetes, radiation, talked about use of illicit drugs, alcohol, cigarettes, and all. So I circled that because that is very, 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 very important, and family history. So let's go to other causes of infertility. Please, can you still hear me? Let me be sure that I've not broken off.
We can hear you.
Okay, testicular thermal stress. Now, the testes are put in the scrotum so that it is at a 2 to 4 degree cooler temperature than the rest of the body. And it is in this cooler temperature that sperm cells are produced optimally. And that's why people that have undescended testes, that the testicle is in the body for 2 years, 4 years before you bring it down, that testicle has already been damaged for sperm function, but can still produce hormones. So now, when people have offending behaviors, IT people, laptop on the lap. In fact, we are doing this meeting, all the men with laptops on your lap, please put it on the table. Because this cumulative putting of hot things like laptop on your laps in the name of trying to work is increasing the heat to that area, is equating the testicular temperature to the body temperature, and is reducing in a cumulative fashion sperm cell production. Heated car seats. You see all these long distance drivers, Lagos to Maiduguri, Lagos to Sokoto, Lagos to Port Harcourt, Bayelsa. They have a lot of heat coming from the engine. They don't take breaks, maybe 1 or 2 breaks along the way, and they continue driving. And this is their career. So this could cause infertility. And then, of course, the argument of boxers versus briefs, those are pants. The older generation, we are used to wearing briefs, but studies have shown that it reduces sperm cell production because of the tightness. And so that's why people are now encouraged more to wear boxers. And then, of course, varicocele, the accumulation of old blood around the testes, apart from free radicals destroying the testes at the microcellular level, it also increases the temperature. So these are the things that cause thermal stress. Oxidative stress has to do with reactive oxygen species attacking the DNA of the sperm. So this is cellular damage. So a man will have an ejaculate, you do his seminal fluid analysis, his count is normal, motility is normal, morphology is normal, and he's still yet to achieve pregnancy. He may have cellular damage. And what are the things that trigger this? Please look at it, poor sleep and insomnia. Oh, don't stress yourself. But this is Lagos. Everybody is stressing themselves here. I'm stressing myself, So these things are real. That's what I'm trying to say. These things that we take as normal actually affecting the quality of our life. Infections like prostatitis and recurrent sexually transmitted infections. Very important. Today gonorrhea, tomorrow gonorrhea. Because you have been escaping it and you have one good pharmacist or one young doctor you have put in your pocket that is always giving you medicine to clear it. You think you have escaped. Cumulatively, infertility is the destiny of such a man. Varicoceles also can cause oxidative stress because of accumulation of deoxygenated blood around the testes. And then, of course, obesity. Obesity triggers adipose tissue inflammation and then triggers systemic inflammation. Now, there's nothing good about obesity. Oh, your wife is very fresh. She's fat and round. I like her like this. Your husband is enjoying. You're feeding him well. Please, those are not compliments because functionally, they destroy the body in different aspects. So these are the oxidative stresses. Environmental stresses has to do with a lot of occupation. A lot of people that work in pesticides, paint companies are exposed to all these chemicals that are direct toxins to the testicles. So people have to find knowledge about where they are working and what are their occupational hazards. But most of us don't do that. Then mental and psychological stress. We see this a lot in urology. I wish we had psychiatrists that could handle this, are interested in the sexual aspect of urology, because most times I end up becoming a counselor, and I surgeons don't have that kind of patience. Sometimes I snap because there's nothing I don't hear. Am I still on this call? I hope I am. Let me check again.
You are.
Okay, thank you.
You are, ma.
Okay, so we said mental and psychological stress, hormonal imbalance. It can trigger that. Everything will just scatter. The mind is very strong on the body. And people just think that, why are you stressing yourself? Well, it's a thing. So we can't even neglect it. And there are a lot of patients that when you reassure them, I have patients that just come and their main fear is fear of being judged for their sexual performance. After I have a long talk with them, I don't see them again. They're happy. In fact, they will call me and tell me that, because they were getting things wrong. And it was giving them a lot of psychological pressure. And so everything scattered. And I said, why now? Who told you this? One ignorant person told them something and they started believing it. So it's very important. This thing can trigger sexual and erectile dysfunction. We have a lot of patients who have psychogenic erectile dysfunction. Nothing physically wrong with them. Hormones are balanced. Vascular structure is balanced. Everything is balanced. No nerve disruption or nerve injury, but just the mind. And of course, it will trigger marital and partner disharmony. And when there's infertility, it's not the time for husband and wife to be fighting. I've had cases where in lawsuits I've had to settle husband and wife fight so that at least they'll go and sleep together and not come to our clinic again. But, that's the job of being a doctor. Sometimes you get roped into what you don't want. So look at the psychological impact of erectile dysfunction on the man. I mean, look at that man's face. They will first of all deny the problem. They will be avoiding lovemaking. They'll tell the wife to go and sleep. They're coming in later. They are busy. And why are they doing that? Because they're afraid. They don't want to fail. And then the woman will criticize them the more. He will keep late nights. It's not because he has anything doing outside. Though. He's afraid of that failure. Depressed, irritable. And of course, it will affect other parts of, other parts of life beyond the sexual whatever. Now, the effect on the woman. This is the woman who is supposed to be getting pregnant. Now, look at her face. She said, does he still love me? Am I still attracted to him? But the one that we women will really hold the man to is he having an affair? Because he's avoiding her now. So by the time all this one happens, everywhere is scattered. No more husband and wife. The end of infertility because they're not together again. Okay, so that's just for comic relief actually. But these are the things we see. Now, hormonal and endocrine stress, I talked about disruption of that pathway, the hypothalamic pituitary gonadal axis, and many things can cause it. Drug abuse and addiction, alcoholism, anabolic steroids for those that are bodybuilding, high-fat calorie diet, and systemic diseases like diabetes. So the treatment of this basically depends on the underlying cause. We must individualize care. Individualize care because no two men are alike. Lifestyle modification, I circled it here. There is no treatment we do in urology that we do not consider lifestyle medication as an adjunct. And then, of course, all the other options of assisted reproductive techniques. Counseling is also very important at every stage. So what are the lifestyle modifications? Generally, exercising, correcting obesity, reduces systemic inflammation and reactive oxygen species, and eventually testicular damage. It improves hormonal imbalance and corrects metabolic syndrome. Of course, patients must discontinue smoking completely. There's no single benefit of smoking. We can tell patients to modify alcohol intake to maybe 7 units per week. What we don't allow is 5 bottles per sitting or more than 10 bottles, 14 bottles in a week. That's wrong. In fact, we even tell people that are looking for children to even stop alcohol completely. I mean, make that sacrifice. You are looking for a child, you and your wife. But we can tell them to reduce. But you see, smoking must stop. Then, of course, all hard drugs. I just smoke marijuana. It's just a little bit of Mary J. No, you are not allowed to have Mary J. It's either you want a child or you continue with Mary J. Mary J can also be your child. So we make it clear to them. We don't have time to indulge in indiscipline. Choices. Very important. And then, of course, for those on steroids, we have to taper it off. I know your job is bodybuilding, you're a bouncer, but please, maybe you can have children, then go back to your bouncing. But for now, steroids is out of it. It's messing up your whole hormonal axis. And then other things like supplements. People say, oh, what supplements? Okay, can I take something extra? There are only 4 that have grade A evidence. Ubiquinone, that's CoQ10, zinc, selenium, and vitamin C. These are the 4. And we usually write these. Now, we have a lot of herbal combination. They'll say this, they'll say that, but a lot of companies put in things that we don't know. Most times, they have some synthetic testosterone, and that might actually be counterproductive to the fertility potential we are trying to achieve. But antioxidants are also important, your daily multivitamins. I prefer to give individual so that I can control. Most of these other combinations may not have the amount that is important, or they may have other things that are not declared or I'm not aware of. So I'd rather give, and I write them individually. It's just that the patient will not have to take multiple tablets, but they don't usually mind. Responsible lifestyle. Unprotected sexual intercourse, fidelity to a partner who also has fidelity towards you is very important. And this is to avoid indiscriminate transfer of sexually transmitted infection from one place to the other. Even if the man has blocked tubes, and we can always extract gametes from from the testicle. You have gone to give your wife repeated gonorrhea and she's having pelvic inflammatory disease. You've also affected her fertility. So there are some decisions, like I mentioned earlier, choices. This is not about being moral. This is about doing the right thing, that must be done so that you reverse some of these changes. And if they are irreversible, then it's just consequences that the couple will be facing. So these are active behavioral decisions that protect against sexually transmitted infection, which is the commonest cause of obstructive azoospermia in Nigeria right now. Eliminate testicular hits, reduce long distance driving, or maybe, I don't know, because of finances, most times in other countries, there'll be two drivers, one will drive halfway and then they will change, so that that driver is not the only one making that long journey, So if we'll find ways to do it, wearing loose underwear, that one is almost routine now. You hardly see any man wearing pants right now. Laptops on the tables and not on the laps. And then reduce soaking in hot baths, hot tubs. Some people still do it. Well, a lot of people use showers in Nigeria now, but some people still like soaking in or going to the spa and stay. We have some men that are quite into beauty routine. So you might need to reconsider some of these things. So in conclusion, male infertility can be very distressing. There are many underlying causes, and these may actually be consequences of previous poor life choices and conducts. Some of them may be reversible. But when we manage patients in urology, lifestyle modification is always advocated, always, to improve outcome. It's an adjunct. And then because the sperm takes an average of 74 days to mature, a range of 70 to 90 days, that's about 2.5 to 3 months, we always insist that when the lifestyle modification has been established, that you should review your seminal fluid analysis within 3 to 4 months of that start of the lifestyle modification, along with our treatments. That's when you begin to see the effect of new generation sperm cells being produced. Thank you very much.
All right, thank you so much, Dr. Bimbola, for that wonderful presentation. Please, we're gonna appeal to you to please hang on for question and answer, but that'll be after Dr. Uchenna has finished our presentation. Please,
I'm still here, so don't worry. I'm not going anywhere.
Right. Thank you so much. That was superb. That was great. We appreciate you. So, Dr. Uchenna, please, you can share your screen and
yes, please. Thank you so much, Dr. Bimbola. I love that. That's the right one. Okay. Oh. Hello, can you see my screen? Am I audible?
Yeah, you are audible. Your screen is seen.
Okay. All right. So I'll just keep all the things that she talked about.
Beautiful.
The screen is not moving. Why is it not moving? What? Okay, let me just go back. It's not moving. Am I still here? Hello. Whoa, okay. So it's like my volume is down. I can't see. Wow.
But we can hear you anyway.
Wow.
Just that we can't see your screen yet.
I can't even see any of my control. Okay. So at least you can hear me now, right?
We can hear you.
But you can't see my screen. What is this?
Not yet.
Wow. Okay, am I going to just talk? Okay.
Okay.
Should I just talk? Because I can see the screen, I just can't post it.
send to one of the other hosts if they can help you project it, the admin or any other person.
All right, let me see. Let me share. What am I sharing? All right, can you see me now? Can you see the screen now?
Yes, we
I'm
can
really
see.
so sorry. Okay, I don't know what is happening, but I'm just going to, okay. We've done the pathophysiology. So we are going to do the key lifestyle factors. She already mentioned time is short. Diet, of course, that's one of our number one pillars. Can you still hear me? My laptop is showing me network unstable. What? Can you still hear me?
We can hear you clearly.
Okay, let me turn off my video. Let me turn off my video. Stop video. Okay. All right. So diet and nutrition is one of our biggest pillars. Then we have activity. We have sleep. We cannot, overemphasize sleep. In fact, sometimes that's even one of the cheap ones to start with, because if somebody has not been paying attention to sleep, you might be able to get that one round so fast. Then we have stress management, and we have avoiding toxins and environmental exposures. I did not add social connectedness here because it's not usually seen in the literatures, but we know that social connectedness is one of the big pillars of lifestyle medicine, and that it has a place in managing male fertility. Because why? We ask people to actually develop like deep relationships. And this time around, we are talking about male infertility. So we are looking at deep relationship with that female, okay, with a female partner. So use. Can you hear me now?
Yes, we can.
We can.
Okay, I don't know what is happening to my network today. Okay. Add on this slide because I did, like literature, but it's still part of it. Now, hello?
We can hear you.
Damn. What is this? Hello?
Okay, we
Yes,
can hear
hello.
you. We can hear you now.
Please go ahead.
Hey, hi.
We can hear you now, ma.
Oh my God, I didn't know.
I want to suggest that we take the Q&A for Dr. Abolarinwa, since Dr. Ochena is having some difficulty. Maybe by the time we're done with the Q&A, maybe she'll be able to come back. Because of time is really taken away.
That will be fine. Let me see. Sorry, let me see.
Okay, I'm online. My internet was shaky, so I couldn't see any question in the chat. So if there's any there, please let me know.
I also can't see any. Let me see the Q&A. Will not be in the chat, but probably in the Q&A. Where is the Q&A boss? President, please, can you see the Q&A boss? I can't see it on my laptop here. Wow. Dr. Jose. Hello, am I audible?
Yes, you are.
Okay, yes, you are audible. So there is
Okay.
no question in the Q&A box. I don't know if there's any in the chat, but I can't see any in the Q&A box.
There's none in the chat, just comments, appreciations.
the chat talked about some urologists prescribe vitamin D and glutathione supplements for male infertility. But what is my take on them? So I would thank you very much, Dr. Abiodun Adelowo. Can I go ahead and answer?
Please go ahead, ma. Go ahead, ma.
Can I go ahead and answer?
Yes, please.
Okay.
Yes, please.
Okay, so Dr.
Please,
Adelowo, what basically all those things are for antioxidants. I also prescribe vitamin D. I always add it because they're very good antioxidants. But literature has shown that those four, ubiquinone, vitamin C, zinc, and selenium, are the ones that have statistically significant improvements in sperm parameters when used. And so whatever you are giving, make sure you don't leave out those four. You can give vitamin D. Some people give Adizwa, some people give Manix. Those are combinations. Sometimes you have to sit down and study them and say, okay, what percentage, what is the recommended daily allowance, and how much of it is in this medication? Is it 100%? Is it 50%? Is it 200%? Many claims. I feel safer giving them the components and telling them that you may have to be burdened with using multiple tablets daily. But I prefer to give the individual components. If they feel like going to use a Prosiv, Manix, Adizwa, fine, they can go ahead, But those four must not be omitted. Vitamin D can be given. Glutathione, I think I have a bit of paranoia about it because of the way people are taking it IV to get lighter in complexion. So I don't consider it too serious for milk fertility. But vitamin D, I definitely write it. I particularly write vitamin D. In fact, I write more vitamin E instead than vitamin D, but these are all antioxidants. They are very good. They work at the cellular level. A typical person in Nigeria right now is hustling so much that the amount of damage that is happening to their bodies is not manifest physically. At the cellular level is so much. So I think even basically a lot of us should be on some degree of supplements, especially if you're above 40. Because of all the stresses. Stress is a very horrible thing, causes a lot of cellular damage. And then the poor man is looking for a child. So I write them. I don't omit vitamin D, I don't omit vitamin E, but I make sure those four are always there. And if they insist that they want to use a combination therapy, somebody sent them one medication from Australia or from Germany, just read the packet and see whether those components are there and to what percentage of the recommended daily allowance, what they call RDA, is written on the list of components of that medication. And they were good to go. I hope I've cleared it out.
Yeah, thank you so much, Dr. Abimbola. Okay, another question here says,
welcome, sir. So another question.
What do you do for a patient with suboptimal early morning erection in a middle-aged patient? Not desires of fertility, but desires of sexual satisfaction.
Okay. So male sexual dysfunction. I will answer the two together. And there's another one on male sexual dysfunction is a risk factor for male infertility. So a patient that has erectile dysfunction, suboptimal early morning erection. Now, early morning erection, I want to correct that opinion. It's actually not libido stimulated. It's actually hormonal surge. There's biennial surge of testosterone at night and early hours of the morning. And that's why a normal man, even if his wife is in Australia and he is in Lagos, we have early morning erection because of the testosterone surge in the morning. So it's a physiological response in a regular man. A little boy too has erection in the morning, particularly when the bladder is full. By the time they go and wee and empty the bladder, the erection will not come down. That is not related to sexual intercourse or the desire for sexual intercourse or libido. No, unrelated. But it is one of the ways we use to determine whether the erectile dysfunction a man has is psychogenic or organic. Organic being that there is an underlying cause for that erectile dysfunction, maybe like diabetes, maybe like low testosterone, or maybe effect of medication like some antihypertensives that can actually cause ED, like centrally acting agents and all whatnot, and sometimes diuretics. So that is the reason why we ask for that history. Now, if a man is having declining early morning erection, he may be having some organic cause of erectile dysfunction. Now, is that loss of early morning erection suboptimal related to a reduction in his sexual function when he so desires? He wants to improve his sexual function. Then that means it's a case of erectile dysfunction. Is his partner complaining about it? That's part of the definition also. So we will now have to assess the person for ED. What is wrong with him? Now, also let you know that even with people that don't have any underlying cause for erectile dysfunction, sometimes the early morning erection with age reduces in, would I say intensity? It's not as turgid, but it will still be there. It is when there's complete absence of it to know that there's actually a problem. So if any man is having issues with wanting better sexual performance and is able to give us reasonable history that he has erectile dysfunction, not somebody that wants to be like how he was when he was 20 and he's 65 or 70. I always tell them, manage your expectations. The issue is not about performance now, it's having satisfactory sexual intercourse. So if you are with a girl that is 25 and you're 70, you are beating yourself about the bush in satisfying her. Those are unreasonable expectations. Yes, we have medications to help and all, but they are not supposed to be long-term. They are stopgaps. And then, of course, I would like to also stress that erectile dysfunction can be seen 3 ways. Number 1, as a disease entity itself. Number 2, as a marker for another more serious events. So most people that have ED are at risk of metabolic syndrome and cardiac events. Number 3, as a complication of another medical disease, especially diabetes mellitus, especially for those type 2 people. Sometimes the first time that a DM person will come is with ED. And when you're investigating, you find out that they're diabetic, glycosylated hemoglobin 10%. You just send them to, Dr. Okunowa and others. So it's a bigger picture. It's not about him just desiring, he is interested in sex. We have to establish whether he truly has erectile dysfunction. Is it psychogenic? Is he organic? Is he having unnecessary expectations? You have to counsel him and tell him to manage expectations. Tell him he's doing well. What he's doing, 1 round, it's okay. He doesn't have to do 4 rounds. Who is doing 4 rounds? So these are some of the things we see. I need to let you know. A lot of men are the ones even judging themselves wrongly. And then risk factor for male infertility. How do you advise the patients? Male sexual dysfunction is a risk factor. If the man is having sexual issues, he's not going to be able to achieve pregnancy spontaneously or naturally. So we may have to offer assisted reproductive techniques, and these are things that are expensive. So as much as possible, we want to finish using all the natural means. We want to try and exhaust all the options to return them back to their natural means of achieving pregnancy. I mean, if it's just a little ED problem with the man, you can manage that with medication or treat the underlying cause so that at least he can meet his wife and have normal sexual intercourse. But if that's an issue, we also need to determine that is the erectile dysfunction on account of the psychogenic pressure of not having a child in the marriage? Because most of the men that they have the fault in infertility feel their failures. They feel their failures. Especially those that really desire a child, not the one that is happy that he has infertility because he doesn't want responsibility. We've also seen those ones. But they won't come to the hospital. The wives will drag them. You can see that they are not even happy to be there. But maybe the whole family have threatened them, and then they will come. And they're not bothered. They don't do anything you tell them to do because they are not interested. But the ones that are interested may have erectile dysfunction that is psychogenic because of the pressure of the childlessness, the fights, the disunity, the stigma. It's there. Looking at their friends with their children in secondary school, and they are yet to even have a zygote. So is that the cause? Or does he have an organic problem that is causing his erectile dysfunction? Is that organic problem also reducing his fertility potential? So you see, this is a holistic approach to care. And it may be multidisciplinary. It may not just be with the urologist alone. And then if none of that is possible and they have some money, we go for assisted reproductive techniques. Extract the sperm cells directly from the testes, especially when you do some tests and you see it has potential to have fertility, but it's just not coming out in the seminal fluid. You take it from there and do your IVFs and all. It will shock you that this same couple, once they're able to get a child or 2 from IVF, all the problems in the family will just resolve. The man will be having good erections. I mean, erection is now not for looking for child, it's for enjoyment. And God has answered his prayers. So you see, it's almost like one thing causing the other and the other causing the other. If you can break that cycle, then the man has good holistic care. It sounds good for men. It's good. Sauna is good for everybody, but it's just excessive. I mean, you can go to the spa, do a sauna, but it's not as if you go to sauna every day. Every day, of course, you are increasing the intratesticular temperature. Are there places where surgical interventions are commonly done for obstructive exospemia? Yes, we have a few private clinics in Nigeria that are doing a microsurgical extraction or TESI or now. There are lots of them. You know, it's just about knowing where. What is the effect of cold plunge on male infertility? There's really no effect on that. No. There's really no effect on that. I don't think I have seen any issue of cold plunge. They do that a lot in these Scandinavian countries, Russia. And there's really no studies on infertility amongst those men that are related to this. I think those are all the questions in the chat box.
All right, thank you so much, Ma. We really appreciate you. There's a message from Dr. Uchenna. So I've asked I will share on her behalf so that she can continue from she's using a phone now. Dr. Uchenna.
Yes, I'm here. I'm so
okay,
sorry.
All right, no problem. Okay.
Yes, thank you very much.
I want to share for you now. Share.
Start from the diet and nutrition.
All right. Thank you so much, Dr. Abimbola. We appreciate you, ma. Pardon?
Yes, thank you very much, Dr. Abimbola. Yes, please.
We can hear you. We can hear you. You're welcome, ma.
Okay. I'm so sorry about that network disruption. I'm back on my phone now. So for diet and nutrition, and I didn't see what they said, but okay, let me use what is on my laptop. So what is recommended for diet and nutrition is a lot of antioxidant-rich foods, whole foods. Now, you know that in lifestyle medicine, what we usually recommend is whole food, plant predominant diet or plant-based diet. A lot of people have challenges with that. They start feeling somehow when you tell them that. They feel like you're asking them to become vegetarian. If you can become vegetarian, fine. If you can become vegan, fine. But what we're saying is whole food, plant predominant diet. So we always want you to start with the plants. And when we are doing this intervention, we always want people to add. We focus on what you are adding before we start the substitution. So if we're removing, for instance, we'll say add more fruits and vegetables. When it comes to the vegetables, please make sure you add leafy green vegetables, your ugu, your spinach, add tomatoes, add watermelon, add flaxseed, orange, cabbage, okra. I just picked a few handful of things that I will always recommend for men. But these diet and nutrition thing is important and it should be taken wholesome. You know, most foods are good. It's just the quantity. So we emphasize portion control. We ask them to add healthy fats. You see, in the healthy fat, you also need your nuts. So when we say take nuts, we don't mean one bottle of granules, please. You can take a handful of nuts. And most times I tell people, okay, take walnuts. I usually use walnuts, pistachio nuts, you know, so that they don't go and overtake. You know, they go and carry one bottle of granite. The doctor said I should take nuts. So they sit down there and then that becomes another problem. But you can also take granules. But we also have tiger nuts. Those ones, I don't know if they are really nuts, but yes, you can also take them. So healthy fats, omega-3s. Now, when you now come to reduce processed foods, reduce trans fats, in fact, reduce deep fried foods, reduce processed meats, stop excess fast food, reduce all the high sugar intake. These are important reductions that we mentioned under the diet. It's basically for everybody, but I know that it also has impact on men who are looking for to enhance their fertility. I've actually seen a clinic where they do IUI, where they tell the men before they come and produce the sperm,
they should be taking walnuts every day. It's a recommendation that they give them when they do IUI. They must have seen that there's some, evidence of it being good for the sperm, which is why they recommend it. Like a month before you come for IUI and they are preparing and everything, it's part of the preparatory notes that they give them. They say the men should take walnuts, a handful of walnuts every other day or every day. So I've seen that, and there must be something in it. Okay, please, can we go to the exercise and physical activity? Of course, you know that as part of our nutrition, water is very important. So hydration is really very important. Okay, coming to exercise and physical activity is one of our big pillars, and we recommend 150 minutes of moderate intensity physical activity every week. 150 minutes. If a person is doing vigorous exercise, like if the person is running, jogging, we can reduce it to 75 minutes of vigorous activity, intensity activity every week. But really, apart from just those 150 minutes, you can do better than that. Sometimes there are some people I know that do as much as 10,000 steps. But I've seen in the research that from 7,000 to 8,000 steps starts giving you some benefits in case you're calculating steps. But if a person is not calculating steps, we stop at the recommendation of the basic. You can do more than that. I always tell people after your meals in the evening, can you just take a little, even if it's a little stroll to walk away that food, and try to add like physical activity to your day throughout the day. It's not just the one that you come and do once or the time you go to the gym. So it's something that has to be done throughout the day, every 20 minutes. In fact, we are past that limit. Every 20 minutes, we are supposed to stand up. Like right now, I've gotten up, I'm standing up. You're supposed to stand up and walk around. Luckily, I'm using a phone, so I can walk around a bit. And it's supposed to be beneficial. Under this, I added avoiding tight clothing. Dr. Polarewa has already mentioned it, but a lot of people that wear some of these gym clothes, it's usually tight for the men sometimes. So I ask them to avoid. And the heat exposure, she has talked so much about it, avoiding hot baths, avoiding saunas. There's a research paper that said the saunas are really not the problem. It's the length of time they spend in the saunas and all that. I think she mentioned it also. The limiting exposure and limiting the intensity of the training for men who do training, especially very vigorous training. I don't know if I should add the jogging and running to it, but there are some training that they do, like resistance training, and it's so vigorous. Some of that might be harmful. Some of that might be harmful because we are still avoiding excessive heat and we're avoiding excessive exercise. So moderation is the key here. Please, next slide. All right, sleep and stress. I've already said that sleep could be one of the very good places to start from if somebody is not having challenges with sleeping. A lot of people, it's not that they have challenges with sleeping, they just form habits. So we just start by telling them to imbibe in sleep hygiene. Like, get ready to sleep. Use your bed for only sleep and sex, and turn down all your gadgets by a particular time, say 10 o'clock in the night. You start switching off all those stuff. And you keep your phones and ringers on silent. There's actually a lot of things that you can do that if you are doing every day, your body will know that you are getting ready for sleep. So that immediately you hit your bed, you start sleeping off. And you shouldn't be on that bed, lying and worrying, counting the whole ceilings. You should actually be able to go to your bed, lie down and sleep. If the sleep is not coming, come out from the bed, sit by the bed and read a book or do something else. But don't go back to the phone. So sleep hygiene is very important. We recommend 7 to 8 hours of sleep every day. Poor sleep affects hormones. We already know that it affects hormone balance and it lowers testosterone. So we already know that the other hormones, because one of the things that we ask people who have challenges with fertility to do is also to lose weight if they are heavy. If they are overweight, we ask them to lose weight. Now we know that if you don't sleep, the leptin and the ghrelin hormones, they will be rioting. So they will not allow you to lose weight. You will end up eating more. So if you sleep better, it will help some of those hormones to balance out. Now, stress impacts sperm quality. I already heard her talking about people who get anxious, just the anxiety that, I've not been able to impregnate my wife and all that can become a burden. She just said it. And it's something that I've noted that some people after IVF, they are now able to have a baby without help, and I've also seen some people who now maybe after adopting a baby, they now have their own. So those are good stories. We know that stress impacts sperm quality so much. So we should inculcate practical stress reduction techniques. And some of these practical stress reduction techniques, we talk about mindfulness, we talk about breathing exercises, we talk about going for massage. So many things that we can do to reduce our stress. Even exercise and sleeping well reduces stress. Next slide, please. Okay, environmental and other lifestyle exposures. This is where we are talking about avoidance of harmful substances. So there are a lot of these harmful substances in the environment already. She told us about the people who are on this call, who have their laptops on their lap and they are men. So that is already a danger because the heat from the laptop is already bad for you. And we talked about the hot tubs and the smoking, alcohol and recreational drugs that are a no-no. If somebody around at the time that you are trying to conceive, you shouldn't take alcohol. We have even come to the point now that is a zero limit for alcohol. Previously, we used to give limits. We tell people that you can take so and so amount of alcohol. Right now, this zero limits. We are not asking you to take any alcohol again. We are telling you that alcohol is bad for you. And alcohol might even kind of, reduce your performance too. People tend to think that it will make your performance better. No, it has been said to reduce performance in bed. Okay, and then the next one is reducing toxin exposure. We have so much, that is in the environment. We have the pesticides. We have all the things that are said to be endocrine disruptors. And for some reason, in this present world, we have so much of it. And also, she mentioned, Dr. Abola also mentioned, occupational hazards, like some people that get occupational heat. I say occupational heat, they get heat, like the long distance drivers and the bikers, because elevated scrotal temperature will reduce spermatogenesis. So we don't want that to happen. I don't know if to ask people, okay, don't drive again or change your occupation, but they have to find a way. She mentioned one of the ways is having two drivers. I hope the people who have this issue might be able to do something about it. Next slide, please. All right, I think we are about winding off, and the part I'm at now is when to seek help. Okay, so when to seek help, you already know that after 1 year of trying. I like the way she hammered on what trying is, because there are some people who are not trying. I've actually seen a couple that I don't know how I felt the day that they came to me, that they actually meet only when the woman is bleeding.
can hear you. Dr. Uchenna.
I think she was locked out, but she's joined again now.
I'm so sorry. It's really terrible today. I can't believe it. Can you hear me?
I can hear you.
Okay, so I'm just going to round up and say when to seek help. So when you have any warning signs, when you've been trying for, hear me.
We can hear you,
Right?
Dr. Uchenna.
Okay,
Yes, we
when
can
you've
hear
been
you.
trying for more than a year, when lifestyle changes may not be enough, we always say that when somebody has infertility or fertility challenges, you start from lifestyle. But there are times when lifestyle changes may not be enough. You shouldn't stall the patient. Patients should be able to seek more help and even do them together. Like see these specialists at the same time as doing the lifestyle changes. Okay, then it's very, very important. As we say, it is very, very important in lifestyle medicine that we continue to refer clients to appropriate professionals and specialists who can co-manage so that as they are managing them, like if your client needs a cardiologist, you refer to a cardiologist. You will still be managing, but that patient is getting that critical care that he needs. Okay, I think that's where I'll just head to the clinical protocol. We do lifestyle factors. I don't think we have time anymore, but you assess the lifestyle factors. We have a way we assess that. You have to do physical examination, especially if you are a doctor. You order semen analysis, and then you implement the lifestyle plans. You reassess after 12 weeks. You know why? Expected outcome, anyway, in the improvement is expected 3 to 6 months. And the interventions, we have already mentioned a lot of them. I think Dr. Boloriwa mentioned the supplements that are given, vitamin C, vitamin E, zinc, selenium, and CoQ10. This reduces oxidative stress and they somehow improve semen parameters, but testosterone is usually not given. He also mentioned it that the reason you don't give testosterone is that the spermatogenesis is needed from the one that is inside you, not the one you take outside. So our interventions include weight loss plan if necessary, sleep correction, smoking cessation or toxin avoidance, including alcohol. I just have to put that there. Antioxidant support. And I think that brings me to the last slide. And the key takeaway is that lifestyle is the first therapy. And we are treating the whole patient, not the semen analysis result. Okay, and male fertility is highly modifiable. This is why lifestyle should be the first therapy. Even if a client is seeing another specialist, the lifestyle one, the lifestyle specialist, the lifestyle professional need to be in on this case from the beginning to help the person to get better results. And here I come to the end. Thank you very much. And I do not know whether we have time to take any questions because our time is fast spent. I still apologize once again for all the disruption in network.
All right. Thank you so much, Dr. Uchenna, for the presentation. That was perfect. No thanks to network and glitches. We sincerely appreciate you. Please, can we just appreciate her as well? Drop our questions. Please, we want to apologize to our esteemed participants, especially those who are joining us out of Solong and even members of Solong. This webinar doesn't take this long, but we We are sorry for what we went through with the network tonight. So please don't feel discouraged to join us next time. So let me look at the all right. So please drop your question if you have any question for Dr. Uchenna, and if Dr. Abimbola is still here, if you have one or two questions in the next couple of minutes, we all right.
Dr. Lani.
All right, ma'am. Yeah, I'm back. Well, I think there's no question. Let me use this medium to appreciate our elder speakers for tonight, Dr. Abimbola and Dr. Uchenna, for the well-packed discussions that they've given to us tonight. And also let me appreciate member of the BOT, member of the Executive Committee, member of the Education Committee, and all our participants, our prof, NMA Semi Committee. NIMSA, I can't recognize by name, but everyone, you are highly appreciated. I want to hand over to the President for announcement and closing remark. President Ma.
Thank you so much, Dr. Olani, for great moderation tonight. And I want to say a very big thank you to our speakers, our guest speaker, Dr. Abimbola Abolarinwa. Of course, I know that she's used to hearing that, being celebrated as the first female urologist in Nigeria, but, we have to celebrate now. So please don't be taken aback anytime we do that. So we celebrate you, and we're so excited to have you tonight. Thank you for sharing that very concise and insightful delivery. We are very thankful to have had you here tonight, despite some of the challenges you've had yourself. I don't want to go into all that detail. Well, thanks so much. And thank you, Dr. Uchenna, our own board certified lifestyle medicine physician. Thank you for taking the time to also research and share insights tonight. I'm so sorry about the technical issues. And, one thing about lifestyle medicine is, one of the things that we say when it comes to stress management is be calm. Just be calm. Sometimes things are just going haywire. You're just taking that deep breath in and out and just tell yourself, see, everything's going to be fine, So we've heard what is most important, and we're very grateful to you. So Dr. Lani has already helped me with all the appreciation for all the different members who are here tonight, different professionals. And we know we have physicians, we have dietitians, physiotherapists, we have exercise physiologists, psychologists, people from different disciplines. And the exciting thing about lifestyle medicine is a team approach, to patient care, so that we can ensure that the whole person is managed appropriately. So before we go tonight, I just want to share some exciting news with us. The exciting news is that the Global Lifestyle Medicine Week is coming up on from the 17th of May to the 23rd of May. It's a week-long commemoration. And so I actually wanted to share something, share my screen just for us to watch something that was shared by the chair. Let me see if I can share it. Just to whet our appetite. We're still going to share it on our platforms, and we're going to give us the key actions that we're going to use, during the Global Lifestyle Medicine Week that will help us to celebrate appropriately. So let me just share my screen. So, and just to remind those of us who are...
is a movement that reminds us that our daily choices shape our health and future. Every year in May, people around the world come together to promote healthier living and raise awareness about the benefits of simple lifestyle habits. The focus this year is on consistency, because small habits practiced daily can create powerful results over time. The theme for the Global Lifestyle Medicine Week 2026 is Live the Dreams, Simple Choices, Powerful Results. This theme encourages people to embrace practical and sustainable habits like healthy eating, regular physical activity, quality sleep, stress management, and positive social connections. Across the globe, exciting activities are being planned, including school visitations, healthy snacks demonstrations, fun fitness sessions, media campaigns, games, and community engagement projects. The goal is simple: to help people understand that health is not built overnight. It is created through the little choices we make every single day. No step is too small. A short walk, drinking more water, sleeping earlier, choosing healthier meals. These tiny actions can lead to a healthier life, family, and nation. Together, let us inspire change, promote prevention, and build a culture of wellness, one habit at a time. Live the dreams. Simple choices, powerful results. Welcome to Global Lifestyle Medicine Week 2026. Global Lifestyle Medicine Week is a movement that reminds us that our daily choices...
Okay. Well, I'm not sure you heard the voice, but I'm sure you saw the captions and you saw the video. So thank you so much for staying in the room with us tonight. We're going to be sharing more with you, both in our emails and on our various platforms. And if you're interested in joining the Society of Lifestyle Medicine of Nigeria, please just indicate in the chat box. I'm sure the link will be shared as well by one of our admin. It's a place for you, to interact with other professionals who are interested in making lifestyle medicine the foundation of medical care. And in that way, we're able to prevent, treat, and many times reverse chronic medical conditions or lifestyle-related diseases. So I want to say a big thank you once again for staying with us. We had almost 100 of us in the room tonight. Very, very exciting. Thank you so much for showing up. Please don't forget that we hold this on the first Wednesday of every month. And so we'll be coming your way again in the month of June. And in the month of November, we'll be having our conference. So please look out for important details about our conference. Thank you, and over. Have a restorative sleep tonight.
All right, thank you so much, Indefatigable President. We appreciate you once again. Good night, everybody. Looking forward to seeing those who are new, joining us for the first time, become members of Solon, so that you can participate and enjoy the full our discussion is usually very superb. Please jump in and join the train. So